Hi, I'm Neil Velleman. I'm one of the directors here at Atkins Physiotherapy Consultants, and we provide IDD therapy as a treatment.
And here at the clinic, you obviously see a lot of people with back pain. What sort of patients do you treat with the IDD therapy?
For IDD, we would commonly see herniated or slipped disc patients with back pain or leg pain, or a combination of the two, that are struggling to improve with traditional types of treatment, i.e. manual therapy, McKenzie therapy, manipulative treatment, etc.
Right. And are of the patients that you see, have many had injections, or some have had injections, they're considering injections?
Some people have had injections already that have either not worked at all or partially worked.
Yeah, right. And what about surgical candidates?
These are people, we see people that have been told that they may need surgery, but not necessarily. These are people that are often either not responding to physiotherapy, or they've had injections that haven't worked, and they're thinking about whether they need surgery.
Okay. And with the idea, what are you trying to do to the spinal segment? You know, when patients are having treatment, what should they expect in terms of their movement or pain, or what's going on?
Well, IDD is a painless treatment, first of all. Patients are generally very comfortable whilst they're having the treatment. What we're trying to do is literally separate the vertebrae and decompress the disc. That has a few effects, if you like. It has an effect of reducing the pressure within the disc. So naturally, like a negative pressure develops within the disc, and it shifts back towards midline.
Right. And what about on the mobility side? Obviously, people with back pain are stiff and immobile, and that's not good for discs. What's happening in terms of their motion? What's the IDD do for that?
Well, the IDD also is helping the paravertebral muscles, the muscles next to the spine, relax, because there's an oscillatory sort of component to the decompression as well. Okay. The muscles relax and the motion improves at the segment.
Okay, so before those muscles are relaxed, what sort of condition are they in? What state are they in, and why is that a problem?
Well, the muscles are usually in a state of spasm.
Right.
It's like a protective mechanism that the body goes into because of pain.
Right. So you're helping to ease that. When you say muscles relax, that means that there's less sort of contraction in the spinal segment.
Yes. So the segment can move more, but once those muscles relax, you can get more decompression at the segment, and the treatment becomes more and more effective as you get relaxation.
And tell me about so does that happen progressively over a course of treatment? Or does that get better then? That's why you have a course of treatment?
Yeah, so the effect is cumulative. So as you continue with the treatment, the relaxation of the paravertebral muscles increases. And obviously the pain of the disorder reduces, so you get less and less spasm, and the effects of the treatment become progressively more.
So patients are having the IDD therapy with the machine. You're combining that with rehab, as I understand it. What's the significance of the rehab element to your program here?
I think when people are on IDD treatment, we wouldn't necessarily give that in complete isolation. People do need to understand that rehabilitation after treatment is important in terms of maintaining strength in their core mechanism, but also just improving their postural habits. So postural rehabilitation is important.
And are those things that perhaps have been contributory to their problem in the first place? So you're trying to address those?
Yeah. So postural imbalances and misuse of the back contribute to the problem in the first place. So we've got to re-establish better habits, normal movement patterns.
Okay, so is it the IDD therapy is like the phase one, if you like, of that process?
Yeah, we would consider IDD as phase one, and then sort of postural and ergonomic training phase two, and sort of rehabilitation, core training phase three.
Right, okay. Fantastic.